So in that case, can Pooja repeat her question?
Yes, please.
Sure. So, this question is for all of us who are listening to this talk. Very enlightening talk, Dr. Kaushal. Thank you. So, in case we see someone close to us, if we witness someone experiencing a heart attack, what are the some of the first things that we do to help this person?
Yeah, very interesting question. I would rephrase this question a little bit, Pooja, because we don't know it's a heart
Sure.
attack, right? Unless we go to a hospital and get
Correct.
a ECG or whatever, right?
Of course,
So
of
first of
course, of
all,
course.
what do you do when somebody close to you has a chest pain? Okay, right. That is
Correct.
that is that is the right
Correct.
question. Yeah.
Correct.
So any person above age of 35, he has chest pain which is reasonably severe. The thing to do is go to a tertiary care hospital. Now, some of you may ask me, what is a tertiary care hospital? Simple. Tertiary care hospital is a hospital which has ICU and cath lab, not just ICU, cath lab. Okay, cardiac catheterization lab where angioplasty is done. Okay, that is very important. You go there, first thing you do, you want to take a ECG. You go to the casualty and get your ECG. After you take your ECG, you insist that an interventional cardiologist sees you, not a cardiologist, not a physician, an interventional cardiologist. Interventional cardiologist is somebody like me who does angiography, angioplasty, right? So that is the thing. Once once they call the interventional cardiologist, the ECG will show whether there is a heart attack or not. But you'll be surprised that the first ECG, there's a 50% chance that the ECG is normal even in presence of a heart attack. We
Correct.
know of certain
Correct.
enzymes which rise. We know of certain enzymes which rise, but these enzymes also take 1 to 6 hours to rise. So severe chest pain is the most important criteria on which we should
Okay.
suspect a heart attack. Okay. Now, meanwhile, while we're waiting for this, we should give them at least 4 tablets of clopidogrel and 325 milligrams of dispirin to chew, along with 20 milligrams of rosuvastatin or 40 milligrams of atorvastatin. Okay. So these are the medicines. One is a lipid lowering agent, the statins, atorvastatin, and another two are antiplatelets. That is what we call dual antiplatelet. Aspirin, dispirin is an antiplatelet, and then we have clopidogrel, which is also antiplatelet. So we should take those two medicines, right? Immediately. Doing this will decrease the mortality to a great extent. Just taking these medicines. Okay. Now, once the ECG is done and the cardiologist sees it, if there's a heart attack, okay. Now, suppose you are in, I don't know, you are in Andheri or you are in Thane, for example, and you are staying in Andheri. You would say, okay, my cardiologist is in Andheri, so I will go and get the angioplasty done from him. Let me go. No, that's not the right thing. If you're having a heart attack, wherever you are, whoever the cardiologist is, you get an angioplasty done there. Okay, because it is not the cardiologist who has passed his DM cardiology boards yesterday is better equipped to do your angioplasty on the spot than the world's best cardiologist the next day. Because as far as
Correct.
heart attack is concerned, time is muscle. Okay, time is muscle.
Correct.
So the window which we have in front of us from the onset of chest pain or from the onset of myocardial infarction starting to the heart muscle dying is somewhere around 6 hours, where 75% of the damage can be prevented. Okay. So if you get it done the next day by the best cardiologist in the world, your pumping will go down and then you will have heart failure for the rest of your life. And believe me, that's a very, very terrible place to be. So get your angioplasty done as soon as possible. You don't have to wait for the plaque to stabilize. You don't have to wait for the things to settle. You have to do the angioplasty in between the attack when the attack is going on. So that is something which is and you get it done immediately by whoever cardiologist is there at that particular site. So this is the sequence of events which I think should be done anybody who has a heart attack. Now, why tertiary care hospital? Because tertiary care hospital has a cath lab where angioplasty is done and equipped ICU, equipped emergency room, where a lot of times the heart stops or becomes very fast. during the heart attack, where you can give DC shock or a shock. You must have seen shocks being given to patients. So that is why this is the sequence of events which you should do.
Thank you so
Don't go
much.
to a
This is
general
very
practitioner.
important.
Don't waste your time going to a general practitioner. Don't waste your time calling a physician. Okay. They don't understand the severity of these issues. The only guys who understand the severity of this issue are cardiologists.
Great. Thank you so much.
Pooja, do you have any other questions?
No, not
Okay, thank you
anymore.
for asking that very relevant question. As a corollary, Dr. Kaushal, is there some medicine that one can keep? Like suppose one is traveling or in a remote area and then they feel that there is a chest pain, or is there something that could be done before one can reach some medical help?
So good that you asked this question, because there is a lot of misconception regarding sorbitrate. Sorbitrate was for a long time considered to be a panacea of all cures. Now, I would say something very counterintuitive, that in fact, when you are suspecting that you have a heart attack, never take sorbitrate. Okay, sorbitrate can actually kill you during heart attack, because sorbitrate basically is a venodilator. It dilates the veins, and it may precipitate the cause of fall of blood pressure. Okay, sorbitrate is a medicine for angina. Okay, angina is chest pain which occurs because the artery is 80% narrow, 90% narrow, and there is a demand supply disproportion. What happens is, when the artery is say 85% 85% narrow, the heart gets enough blood when it is beating at 85 beats per minute, which is normal, 75 beats per minute, 80 beats per minute. But when you start running, the heart rate increases to 120. That time, the oxygen requirement of the heart increases twofold, say example.
Okay.
So at that point, the heart does not get enough blood, does not get enough oxygen carried by the blood, and therefore heart rebels in the form of chest pain. Okay.
Okay.
So that is relieved by sorbitrate. Sorbitrate relieves pain due to a fixed obstruction. Now, one thing about heart attack is, heart attack occurs not when there is 80% obstruction, not when there is 85% obstruction, not when there is 99% obstruction. By definition, heart attack only occurs when the artery is 100% occluded.
Okay.
So in that case, sorbitrate is not going to open the artery. And if the blood pressure is low because heart is not pumping enough blood because of the heart attack, sorbitrate will make it fall further and actually kill the patient. So sorbitrate is underrated. Believe me, in last 10 years, I've hardly written sorbitrate for my coronary artery disease patients. It has some role in, say, for example, heart failure. That is another topic. But for coronary artery disease patients, I have not written sorbitrate for last 10 years simply because I believe if there's a block, the most logical thing is to open the block and do angioplasty and stenting.
Okay. So in that case, is there anything to be done?
So you have to you should keep statins with you. You should keep clopidogrel with you, and you should keep Disprin with you.
Okay.
Disprin is a very simple medicine which is widely available. You can just get a Disprin and chew that Disprin. That itself decreases your chance of dying by 28%, just taking that one tablet.
All right.
And then clopidogrel and statin will increase that even further.
Thank you so much.
You're 30 to 40% less likely to die if you take this before going to the hospital.
Okay. Oh, this was eye-opening. Like I have heard about this sorbitrate from everyone. So good that you clarified that.
Don't do that.
Not a good idea. Okay. All right. So now, I had seen Amisha, and now again, she seems to have left. Okay. Hi, Amisha. Are you around?
I don't think so.
She's back. She's back.
So that we can take her question first regarding the marathon thing.
Yeah. Where is she?
Yeah, she's.
Amisha?
Right here, the network just got disconnected.
Yeah.
Can we take your question now, Amisha?
Yes, please.
Okay.
Yeah. So you want to ask the question again, or what? You just want me to answer it?
Yeah, I'm okay, but it was just I heard for the first time you will not suggest
Yeah.
running a
So yeah.
marathon.
So for anybody, you have to define your goals. Okay. Like what you want. Okay, from any exercise. Okay. Now, my I do not take lectures or uh, give advice to health advice to Usain Bolt or Virat Kohli, or any of the cricketers or professional, or Messi for that matter. Okay, my advice is for normal 40-50 year old guy who has been reasonably active but not very athletic, right? My advice is for them, and all this applies to them. Okay, now we have a misconception in our mind that more is better. No, it's not like that. Moderation is the key. Okay, now you have to define why you want to run the marathon. Okay, your object is very important. Why? Okay, so if you want to run the marathon because your friends are running the marathon, that's not the right reason to run the marathon. If you want to run the marathon because you're always running the marathon right from when you were a kid, that's a different story. If you want to start something which you are unaccustomed to whole of your life, okay, at a 35-40 years age, that's never a good idea. Now, let me tell you the normal physiology when the heart is at rest. Okay, it pumps 5 liters of blood per minute to supply blood to the whole body, right? When you exercise, this increases to 50 liters and as much as 100 liters per minute. Okay, so the flow of blood becomes very turbulent. So normal 20-year-old guy or a 25-year-old guy who is running the marathon typically has very supple arteries. Okay, the arteries are very spongy and tensile. So they can accommodate the increased blood flow by increasing their capacitance, by dilating, right? As we age, atherosclerosis occurs. The arteries become hardened. Calcium starts depositing into the walls of the arteries. It's a function of aging, how you develop wrinkles, how you develop white hair, right? Now, because of that, the arteries become hard, and even the coronary arteries becomes hard, even if there is no blockage. Now, if there is even some blockage, like 40%, 50% blockage, and you pump blood in the arteries at a rate of 100 liters per minute, what is going to happen is the artery is going to tear. And when that artery tears, it forms a clot there, and you get a heart attack. Okay. Sometimes the major artery supplying blood to the whole body, known as the aorta, can tear. When that tears, you end up with aortic dissection, which is a life-threatening condition with as much as 40 to 50% mortality today. Okay. Another thing is when you run the marathon, you are basically running in zone 5 cardio with a heart rate of around 150 plus, 150, 160, 170, right? At that heart rate, you're actually stressing your body. You're actually stressing your body, and your body incurs what is known as oxygen debt. Okay. Oxygen debt is, it is basically running in an anoxic environment. It is running in absence of oxygen. When that occurs over a prolonged period of time, for example, over 2 or 3 hours, or when you're training repeatedly, especially if you are not warmed up, especially if you are not in a habit of running from childhood, right? Those areas of heart which do not get enough oxygen die, and they form islands of dead tissue. And this causes electrical inhomogeneity. That is, the current of the heart gets destabilized because there are dead areas which you place inside the normally contractile heart, So you may get a heart attack and die, or the heart may start behaving irresponsibly, may start contracting irregularly. And you can get a heart rate of 400, 500, what is known as ventricular tachycardia, ventricular fibrillation, and you may die. Also, it is a fact that marathon runners have higher incidence of coronary artery disease than their age-matched controls who are healthy and exercise normally. In fact, if you see any of our old cricketers, especially the bowlers, Bishan Singh Bedi, Kapil Dev, Madan Lal, all of them have undergone coronary artery bypass surgery or have died suddenly. Even Saurabh Ganguly, for that matter, right? So all these sportsmen, Brian Lara, he had a bypass angioplasty done. A lot of these people have this because extraordinary exertion has its own price to pay. Now, if you're a professional sportsman, that price is worth it. But if you are just a normal person, it's just not worth the price. Secondly, are you incurring any benefits? By running the marathon, are you incurring any benefits? So, yes, you are increasing your stamina, what is known as VO2 max, and that has long-term implications. But this comes at a big risk, at the cost of getting a heart attack in the process. Let us see what are the exercise recommendations of American College of Cardiology and American Heart Association. Okay, so American College of Cardiology and American Heart Association say 35 minutes of moderate intensity cardio done 3 days a week is enough. And 2 or 3 days a week, you should do weight training. That is the recommendation of American College of Cardiology. 5 days a week of moderate intensity exercise. Okay. Now, cardio which you should target is zone 2 cardio. Now, I have reels on that. You can go back to my reel to understand that in more details. But I will let you know in brief what is zone 2 cardio, and that is the one which you should be practicing at our age. That is the only one which you should be practicing, and it's much easier than you think. So you have to remember the number 220. Okay, that is the magic number. 220 minus your age. That is the maximum heart rate. You multiply maximum heart rate by 0.7. 70% of your maximum heart rate is the heart rate at which you should be exercising. This is zone 2 cardio, and it renews the mitochondria. Mitochondria, if you go back to high school biology, are powerhouses of the cell. Okay. So you renew the mitochondria and increase your longevity. These are the maximum longevity benefits. Zone 2 cardio. Okay. Anybody, you ask any sports physiologist, give me a single exercise which will make me live longer, which will increase the longevity. The answer is always zone 2 cardio. And say if you're 50 years old, this 70% heart rate becomes 120. Exercising at 120 heart rate is hardly anything. Right? Amisha, does it answer your question? So do run the marathon if you are a marathon runner from childhood. Do run the marathon if it's your passion. But
Yes,
don't
I
run the
agree
marathon.
totally with you. I agree totally with you. It just came as a surprise statement for me, so I became curious about it.
No. It is always moderation is the key. Never
Correct,
go
correct.
overboard.
Totally agree. Yes.
Yeah. You are not
Thank you.
supposed to do these heroics. If you are a football player, you have to run. If you are a
Correct.
football player, you have to only practice in zone 5 cardio. If you're Virat Kohli, you'll practice only in zone 5 cardio. But you are not
Right.
Virat Kohli or Shubman Gill, right? Or you're not Messi.
Correct. Absolutely. Thank you so much.
Your goal should be important. You should have in mind what is your goal.
Right.
Thank you.
None of you should try and run the marathon. Yeah.
This was
But
very
I mean, I'm telling you, all these cardiologists know this, but still, I have a few cardiologist friends that are still running the marathon. Yeah.
Thank you for bringing this out, Amisha, by asking that question. And thank you, Dr. Kaushal, for giving some very invaluable information, because this defies the common logic. Everyone feels that, okay, we
No,
should.
it doesn't. Actually, it doesn't. Common logic is moderation. That is the commonest logic.
Right.
Yeah.
Got you. Moderation. That's the golden word.
Moderation is the key.
Correct. Okay, moving on. Jay, you are silently listening to us. Do you have any question for your SoBo friend?
I have a question.
Yeah, sure.
Yeah, please, Nisha.
Yeah.
Yeah. So how do we distinguish the pain, angina pain, and like in day-to-day life, we come across that if there is a pain in the left side, it is an indication towards your heart issue or something. So how do we distinguish that pain between
So let
angina
me tell,
pain?
so let me tell you two things. Okay, there's a difference between angina pain and heart attack pain. Okay, don't confuse the two. Angina is a stable situation where there's a demand supply disproportion. It indicates the heart artery is 80 to 90% blocked, but not 100%. Right. Second is the pain of heart attack, which is when the artery gets 100% blocked. Okay, let us talk about angina first. Angina is nothing but demand supply disproportion. The artery is 80% blocked, so you generally don't feel pain when when you're resting, when you're sleeping, when you're sitting. The heart rate is 85, heart gets enough blood. When you start exercising, when you start climbing the stairs, when you start running behind a bus or something, then the heart rate increases to 120, 130. The myocardial oxygen demand increases, and the heart cannot, under those circumstances, get enough blood, enough oxygen. Therefore, it protests in the form of pain. Okay, this is anginal pain. This again stops if you rest. Okay, because the heart rate comes back to normal in a minute or so. So the heart rate comes back to normal, oxygen supply requirement again normalizes, and you don't get pain. This is typical anginal pain. It was commonly believed to be left-sided, but there's nothing sacrosanct about being left-sided. I have seen patients just getting right-sided pain. I've seen patients getting both-sided pain. I've seen patients getting just jaw pain and go to a dentist for toothache. I've seen a patient, they got a tooth extracted, but pain has not gone. And then we have found out that there's a block in the arteries of the heart. Then it can happen in both the hands, both the wrists. So it can occur from anywhere between the angle of the jaw, that is the mouth, to the umbilicus, that is the belly button. Okay, it cannot go beyond the belly button. It cannot go above the mouth. This is where anginal pain in this area, between this area, it can occur anywhere. Generally, it is a sense of disquiet. It's a sense of uncomfortable feeling. There is a sense of pain, heaviness. Somebody has climbed on your chest. Somebody squeezing your chest. Sometimes it's just breathlessness. These are all angina. Chest pain of heart attack is very distinct. It's extremely severe, one of the most severe pains possible. And the person will say that as if an elephant has climbed on my chest, and they'll be wriggling with pain. They'll be wriggling with pain. That is very different. So just clarify
And when
this.
can CPR be given in such cases? Like when should
No,
we
no,
give
CPR is when the, so CPR is
That is
another lecture.
okay.
CPR is when the heart stops beating.
Okay.
CPR, I think we should take a lecture on that. Yeah. CPR is demonstration totally. Yeah.
Okay. Pratiksha, you want to ask something?
Yes, I did have some questions, but I'll have to go to the checklist and ask in the meanwhile if anyone wants to ask, because I had asked some 6 questions, so
I
just a
can
minute.
refer to your set of questions, but in
Checklist.
anyone else, Chandni, do you have any queries?
Hey, thanks for checking.
Okay.
So, Dr. Kaushal, can you give the name of the two medicines which you had named, Dispirin and one more, to be given for emergency case?
There were 3
And
medicines.
yeah, Dispirin, clopidogrel, and rosuvastatin.
Okay, but just could you let's
Put that
Dispirin
in the
325.
chat
the
group
name?
later.
Yes.
So 4 tablets of clopidogrel. Oh yeah, I can put in chat. You guys see my reels. Everything is there.
Right.
I'm really telling you.
So can I ask one question?
That is the reason I'm making reels.
Yeah.
Yeah.
We're enjoying them actually.
Yes, quite informative again. Even I am going through your.
No, so the reels have, there is no, call to action button. Like, a lot of people have this call to action button and all those things. My aim is just to spread knowledge and, disseminate right information in the community. I don't want any call to action. Yeah.
Yes, Mr. Venkat.
How important it is to exercise the calf muscles?
exercise the calf muscles.
Yes.
Yeah, so
They
that's
are
an
known as the
important
second
question.
heart, I believe.
Oh, yeah, so that is in a different sense. Soleus is known as the second heart, but that is in a different sense. So I'll tell you something. So calf muscles are important. So let me take this question and let us just expand it to answer what is the importance of first uh, cardio versus weight training, and secondly specific about calf muscles. So a lot of people think that when they want to lose weight, what they should be doing is cardio, because cardio gives you like energy which is burnt. Like, for example, if you run for 1 hour, you'll probably burn some 200 calories or 300 calories, right? 400 calories maybe. So that is in front of you, and you feel that makes you thinner, and it is true, but only partly. Okay. While if you're doing weights, even if you do weights for 1 hour, you'll probably burn some 7,500 calories, 120 calories, even if you do weights for 1 hour. So intuitively you feel that it's better to do cardio to lose weight, right? But no, it's not true, because when you do weight training regularly, there is muscle breakdown, and if you supplement your weight training with adequate amount of proteins, then there is muscle buildup. Over a period of time, your body composition changes, and you have a lesser percentage of fat and higher percentage of muscle. When your muscle percentage in the body increases, what happens as a consequence is your BMR increases. It's like investment, right? You play a lottery and win 400 rupees, or you invest that 100 rupees which you have won, with which you have bought the lottery, into mutual funds. Over a period of years, those 100 rupees may become 1 lakh rupees, right? So it's the same way with BMR. When your body muscle mass increases, when your body muscle percentage increase, these muscles are in a constant state of contraction even when you're sleeping. Okay, so they are constantly burning energy. They may be burning 1 calorie per minute, but it's without you doing anything, right? It's like your money working for you in mutual funds. Similarly, these muscles are working for you, burning your calories when you sleep. So a muscular person burns more calories when he's doing nothing. So a combination of cardio and strength training are important. Secondly, I would like to say, you don't want to be a bodybuilder. I understand. Even women should do weight training, because longevity depends on two things. Okay. Longevity, as far as exercise is concerned, depends on three things actually. One is balance. Okay. For that, yoga and other balance exercises are important. Number two is leg strength. So if you're doing leg exercises, like even calf raises, calf muscles, and even the quadriceps and the hamstrings, everything. If you do the front of the leg, the back of the leg, all those exercises regularly, then your leg muscles and your limb girdle will become strong. And if your limb girdle becomes strong, you will not lose balance. Okay. And you will be able to walk. The ability to remain mobile later in life is a very important predictor of longevity. Second is grip strength. This is something which a lot of us do not know, do not neglect. Now, a lot of studies have been done in which octogenarians, 80 years plus individuals, their grip strength determines how long they live. Okay. There are some springs available, machines available, in which you can put it on your arm, and you can forcibly compress it and release it, right? So that is grip strength machines, right? So those machines are very important, because if you're falling, if you're an 80-year-old guy, if you're falling and you get something to hold on to, your grip strength will determine whether you fall or you don't fall. Okay. And if you fall as an 80-year-old, you'll probably fracture your hip bone, or fracture some other bone, which will never heal. You'll be bedridden, and that is the end of it. So two important things. And what we will become, we are normal till we are 50. We start losing muscles, sarcopenia, in our 6th, 7th, and 8th decade. But the rate at which we lose muscle depends on the initial muscle volume. So this is the time, 50 to 70 is the time when you build your bank balance of muscles. Therefore, every one of you should do weight training. And the calf muscles, it's important. There have been some studies, though they're haphazard and that's not very strong recommendation. But if you do calf raises, right? For example, 15 calf raises 3 sets, that decreases blood sugar levels. That is a direct connection with the blood sugar. So that is a direct answer to your question.
Great. Acha, 2D echo shows ejection fraction. So what bearing does it have? A low ejection fraction symbolizes, what does it mean actually?
So ejection fraction is the volume of blood which is in the heart, which is pumped outside. Nothing is 100%. Normal ejection fraction is 60-65%. Okay. That is normal ejection fraction. And when you get a heart attack or when you get muscle disease of the heart, which is known as cardiomyopathy, this pumping decreases. So it may become 35%, it may become 30%, it may become 25%. As the EF goes on lowering, ejection fraction goes on lowering, the patient becomes more and more symptomatic. So this is like a very detailed, like this discussion can go on for hours, but unless it's a specific question for a particular person, I don't think a general population needs to know about it in such details. I mean, if you have a patient who has a heart failure, then of course, because there are so many concepts involved in this, right? From how much water to drink, how much salt to have, everything plays a role. What kind of exercise should be they doing? And can it increase? What are the drugs? What precautions should be they taking? Yeah, so all those things. There are a lot of questions in that.
Okay. Thank you so much, Dr. Kaushal and Mr. Venkat for asking that query. Now we have about 5 minutes left for again getting logged out. So would anybody else like to ask any questions? Nisha, Chandni?
Had some questions. No?
Yeah. Or should I ask from the earlier submitted questions? Okay.
I have a query.
Yeah,
please.
I have a query, but I would like to ask Dr. Kaushal whether he would like, because there's only 5 minutes left right now, so whether he would like to continue a third session today or he would like to keep another session next week or next to next week. So accordingly, because then I don't mind asking questions or whatever he and the audience wants.
So I think we can have another session because many questions are not covered. So, but we'll see whether next week of after 15 days a month, whatever, whenever it is. Yeah.
Okay.
You can ask the question in the meanwhile.
So my question was that what is the basic difference between heart failure and heart attack? And at what point should one go for bypass surgery and one decide to go for angioplasty?
Again, these are very detailed questions. So I'll ask you, what is heart attack and heart failure? Heart attack is like when the artery is 100% occluded. You get severe chest pain, that is heart attack. Okay. Heart failure is when it can occur in two conditions. Either the heart attack has occurred, you have not opened the artery, you're not gone for angioplasty immediately. And mind you, it is very important that during heart attack, I told you that emergency angioplasty should be done, right? You should go to the casualty and you go to the emergency room and get a cath lab, go into the cath lab and get a interventional cardiologist to an emergency angioplasty. That's the only treatment, right? You can't do an emergency bypass surgery. There's nothing like an emergency bypass surgery. The person, if you take this patient for bypass during acute heart attack, the person will die because heart is extremely soft like butter and it won't hold any stitches. So the only treatment is angioplasty, emergency angioplasty. So that is there. Heart attack is like when the artery is 100% occluded, and what I just described to you, a severe pain, and that is heart attack. If you don't treat the heart attack by angioplasty or medicines, then the heart pumping goes down. That is heart failure. Whenever the heart pumping goes down below 30-35%, that's when severe failure symptoms start manifesting, and they are like breathlessness and uh, uh, decreased stamina, increased fatigue, and then these patients can actually die.
Okay.
Sometimes because of irregular heartbeats and stuff like that. So it's important that you treat your heart attacks properly so the patient does not go into heart failure. Of course, another cause of heart failure is um, low disease of the muscle itself. It's another story that nowadays treatment for heart failure is also improved a lot, and very many new drugs have come for treating heart failure, with which heart failure patients can also live a long life, and some of them can even reverse their low ejection fractions and become normal also, continuing taking the medicines. So, but that's a very complex question. This is a very complex question.
Okay.
Yeah.
Okay. So I think I will re-ask
Angioplasty and
this
bypass is,
question.
I think, it's a very detailed topic. I think need a
We'll
long time
cover
to
it in
address
the
that.
next session. No problem.
Yeah.
And I think just 1 minute is left. So Dhawan, would you like to give your vote of thanks? And
Yes, I think we will end today's talk now. So thank you so much, Dr. Kaushal, for a very, informative and valuable session, for sharing your knowledge and expertise. And thank you to the participants for asking some very pertinent and relevant questions, which, everyone, I hope, have gained knowledge out of that. And
And lastly, I request all of you to subscribe to my channel and see my reels regularly, because they are just questions like this which I address in my reels every day.
yes,
yes, we'll do.
of course.
Sure.
So,
Yeah, sure,
Okay.
sure.
And his reels are creative also, so it's worth watching. Like it's not boring like most of it's not like doctor reel, it's like very creative. So I've seen a few of his reels, very enjoyable. Yeah.
yeah, they are not at all serious, or, it's very